Hey there, amazing men! Welcome back to Men's Protect channel, where we light up the dark corners of men's health and bring you surprising truths that can change your life. Today, we're diving deep into a topic that touches almost every man as he gets older, especially once you cross that fantastic 40-year mark. We're talking about the prostate. Now, just saying prostate problems can make a lot of guys feel a little bit uneasy, maybe even a little bit scared. It's a part of our body that we often don't think about until it starts acting up. And when it does, it can bring a lot of worries. Worries about endless bathroom trips, worries about comfort, and yes, sometimes even bigger worries. Many men believe that having prostate problems is just an unavoidable part of getting older, like getting gray hair or needing reading glasses. They think, oh, I'm over 40, 50, 60. This is just my destiny now. But what if I told you that's simply not true? What if I told you that while prostate changes are common as you age, the problems that come with them are often not inevitable? What if I told you that for most men, these problems are actually solvable? And even better, many of them can be stopped early, sometimes even before they really get going, if you know the secrets. That's right, you don't have to just throw your hands up in despair and accept discomfort or worry as your new normal. You have power here. You have control. And today, I'm going to show you exactly why prostate problems happen, and then, the exciting part, how to stop them early. You won't believe how simple some of these powerful strategies can be. So, let's start at the very beginning. What is this mysterious prostate gland anyway? Imagine your body is a bustling city, full of pipes and roads and important buildings. Your bladder is like a big water tower that holds all the water, your urine, until it's time to let it out. Right below this water tower, for men, there's a small walnut-sized building. That's your prostate gland. Think of it as a tiny, very important guardian. It sits right around the drain pipe, your urethra, that carries urine from your bladder out of your body. Its main job, besides helping with the drain pipe, is actually to make a special fluid that mixes with sperm to create semen. This fluid helps the sperm swim and keeps them healthy. So it's pretty important for both going to the bathroom comfortably and for making babies, if that's still on your mind. Now, this little guardian, the prostate, is supposed to be soft and smooth, like a plump little grape. And when you're young, it is. But as we men get older, sometimes around 40 or 50, this little gland can start to change. It's not usually doing anything bad on purpose, it's just following some very old, sometimes tricky, instructions from your body, and these changes are where the problems can start. Let's talk about the main troublemakers that can affect your prostate. There are generally three big ones that men talk about and worry about. The first big troublemaker is called benign prostatic hyperplasia, or BPH for short. That's a mouthful, right? Let's call it the growing pillow problem. Imagine that drain pipe we talked about, the one from your bladder. Your prostate is wrapped around it like a donut. When you're young, the donut is perfectly sized. But with BPH, this donut starts to get bigger. It's like a soft, squishy pillow growing around your drain pipe. It's not cancer, and it's usually not dangerous in itself, but as that pillow grows, it starts to squeeze the drain pipe. Think of squeezing a garden hose. What happens? The water flow gets weaker, right? That's exactly what happens when your prostate grows bigger and squeezes your urethra. You start to notice things like you have to go to the bathroom much more often, especially at night. It's like your bladder is yelling, "Hey, I'm full," even when it's not super full, because the pipe is squeezed and it feels like it needs to push harder. When you do go, the flow is weak, like a trickle, not a strong gush. And it might start and stop. You feel like you can't fully empty your bladder. You just went, but 5 minutes later, you feel like you have to go again. It's because the squeezed pipe means some water stays behind. Sometimes it might even feel urgent, like you have to run to the bathroom or you won't make it. Now, for a long time, doctors just said, "Oh, BPH. That's just age. Every man gets it." And it's true that most men will have some prostate growth as they age. But the shocking truth is that the problems from BPH, the symptoms that bother you, are often not just about age. There are other secret ingredients that make that pillow grow too big, too fast, and squeeze that pipe too hard. And these secret ingredients are things you can actually control, We'll get to those solutions soon, so stick with me. The second big troublemaker is called prostatitis. This word sounds a bit like prostate-itis, and itis at the end of a word usually means inflammation or infection. So think of this as the angry guardian problem. This is when your prostate gland gets irritated, swollen, or even infected. It's like your little walnut-sized guardian is really mad and puffed up. Prostatitis can happen for different reasons. Sometimes it's caused by tiny little invaders, like bacteria, getting into the prostate and causing an infection. Other times, it's not an infection at all, but the prostate just gets inflamed and angry for reasons we don't fully understand, maybe from stress or nerve problems, or even certain foods. The symptoms of an angry guardian are usually quite different from the growing pillow of BPH. Pain. This is the big one. You might feel pain in your groin, your lower belly, your lower back, or even in your genitals. It can be a dull ache or a sharp burning feeling. Pain when you go to the bathroom or when you ejaculate. Sometimes fever and chills if it's a strong infection. And yes, sometimes it can also cause frequent urination, similar to BPH because the swollen prostate is irritated. Prostatitis can be really uncomfortable and confusing because sometimes it comes and goes. But again, it's usually treatable and not something you have to live with forever. It's definitely not just age. And finally, the third and most serious troublemaker is prostate cancer. Now take a deep breath. Just hearing the word cancer can be scary, and that's okay. It's natural to feel that way. But here's what you need to understand. Prostate cancer is usually a very different kind of problem than BPH or prostatitis. It's not just a pillow growing, and it's not just a temporary infection. This is when some of the cells in your prostate gland start growing out of control. Here's the absolutely crucial part. Most prostate cancers are very slow growing. They don't typically explode overnight like in movies. Many men can live long, healthy lives with prostate cancer and may never even need aggressive treatment because it grows so slowly. Often, in its early stages, it has no symptoms at all. That's right, you might feel perfectly fine, no bathroom problems, no pain, and still have early prostate cancer. This is why it's so important to talk to your doctor about screening, which we'll get to. So, while age is a risk factor for prostate cancer, it becomes more common as we get older. It's not the only factor. Genetics play a role. If your dad or brother had it, your risk might be higher. And, as we'll discuss, your lifestyle and what you eat can also play a huge role in either protecting your prostate or making it more vulnerable. The key message about prostate cancer is early detection saves lives and ensures that if it does happen, it's caught at a stage where it's most treatable, often with excellent outcomes. So, no despair here, just knowledge and action. So, now we understand why these prostate problems happen: the growing pillow, BPH, the angry guardian, prostatitis, and sometimes the silent invader, prostate cancer. But here's the really exciting part, the part where you take back control, how to stop them early. This is where you become the superhero of your own health. It's about building a strong defense, creating a fortress around your little prostate guardian so these troublemakers can't cause so much havoc. Think of your body as a high-performance machine, like a race car. To keep a race car running perfectly, you don't just wait for it to break down. You give it the best fuel, regular tune-ups, and avoid doing things that wreck the engine. Your body is the same. You have immense power to influence your prostate health, often much more than you realize. It's about being proactive, not just reactive. It's about being smart, not just hoping for the best. Let's dive into your prostate protection playbook, your secret weapon kit to stop prostate problems early. The first and arguably most powerful tool in your playbook is your diet, fueling your factory with premium gas. Imagine your cells, including your prostate cells, are tiny little workers. What you feed them directly impacts how well they work and how much trouble they stir up. Say yes to nature's rainbow. Think bright, vibrant colors. Lots of fruits and vegetables are packed with special prostate superheroes called antioxidants and phytonutrients. These are like little bodyguards that protect your cells from damage. Tomatoes, for example, especially cooked ones like in sauce, are loaded with lycopene. Think of lycopene as a powerful shield for your prostate cells. Other great heroes include broccoli, cauliflower, Brussels sprouts, those green trees, and cabbage. These cruciferous vegetables have special compounds that help your body fight off bad stuff. Berries, citrus fruits, and leafy greens are also fantastic. The more colors on your plate, the better. Embrace healthy fats. Not all fats are bad. Good fats are like smooth, clean oil for your factory's engine. Think avocados, olive oil, nuts, especially walnuts, which look a bit like a brain, but are good for the prostate too. And seeds like flax seeds and pumpkin seeds. These fats are anti-inflammatory, meaning they help put out that smoldering fire we talked about earlier. Omega-3 fatty acids, found in fatty fish like salmon, are super fire extinguishers for your whole body, including your prostate. Drink green tea. This isn't just a fancy drink, it's a prostate powerhouse. Green tea contains compounds called catechins that act like tiny warriors, protecting your prostate cells. Make it a daily habit. Be smart with meat and dairy. You don't have to become a vegetarian overnight, but think about moderation. Too much red meat, especially processed meats, like hot dogs and deli meats, and too much full-fat dairy can sometimes fuel inflammation and put stress on your prostate. Think of them as lower octane fuel that can make your engine sputter a bit. Balance is key here. Cut the sugar and processed foods. These are like pouring sand into your factory's gears. They cause inflammation, stress your system, and offer zero benefits for your prostate. They're basically giving the energy thieves a big party. Seriously reduce sodas, sugary snacks, white bread, and anything that comes in a highly processed package. Your prostate and your waistline will thank you. The second powerful tool is exercise. Keep the pipes clear and the engine humming. You don't have to become a marathon runner or a bodybuilder. Just consistent movement is your secret weapon. Why it works? Regular physical activity helps you maintain a healthy weight. And guess what? Carrying extra weight, especially around your belly, can increase inflammation and mess with your hormones, which directly impacts your prostate. Exercise also improves blood flow throughout your body, including to your prostate. Think of it like keeping the plumbing clear and ensuring fresh, clean fluid is always moving through your system. Stagnant water in pipes is never good, right? Moving your body keeps things flowing. What to do? Aim for at least 30 minutes of moderate exercise most days of the week. This could be a brisk walk, swimming, cycling, dancing, or even just doing active chores around the house. Find something you enjoy so you'll stick with it. Even small bursts of activity add up. Every step counts towards a healthier prostate. The third tool in your playbook is hydration, the power of pure water. This sounds so simple, right? But it's often overlooked. Think of your body's pipes again. If you don't drink enough water, the fluid flowing through your prostate's pipes becomes thick and concentrated. This can irritate your prostate and make it harder for it to do its job. Water helps to flush out waste products and keeps everything flowing smoothly. Aim for at least 8 glasses of pure water a day. Don't wait until you're thirsty. That's already a sign of dehydration. Water is your prostate's best friend. Next up, stress management. Calming the worried factory manager. Remember that hidden stress that activates cortisol, the frantic security guard. We need to teach that security guard to relax. Chronic stress is like a constant alarm going off in your body, and it directly fuels inflammation and can mess with your hormones, including testosterone, which impacts prostate health. Find ways to unwind every day. This could be something as simple as deep breathing exercises for 5 minutes, listening to calming music, spending time in nature, practicing mindfulness, or connecting with loved ones. It's about consciously telling your body, it's okay, you can relax now. When your mind is calm, your body is calm, and your prostate can function better. And here's a quick reminder from our previous video, which is a powerful tool in your prostate playbook: healthy sexual activity and regular ejaculation. We learned that far from being harmful, regular ejaculation, whether from sex with a partner or masturbation, appears to have a protective effect on your prostate. It helps to flush out those tiny pipes, removing old cells and potentially harmful substances, and promotes healthy cell turnover. So, enjoy your healthy sex life. It's actually a partner in your prostate health journey, not something to worry about. Finally, quality sleep. Recharging your factory's battery fully. Just like we talked about with energy, good sleep is vital for your prostate. It's when your body repairs, rebalances hormones, and puts out inflammation. If you're not getting enough deep restorative sleep, your prostate suffers too. Practice good sleep hygiene. Go to bed and wake up at consistent times. Make your bedroom dark, quiet, and cool, and avoid screens before bed. If you suspect sleep apnea, loud snoring, stopping breathing in your sleep, talk to your doctor immediately. Better sleep means a happier, healthier prostate. Now, all these lifestyle changes are incredibly powerful. They are your first line of defense, your everyday superpowers to keep your prostate healthy and to stop problems early. But there's one more, absolutely critical part of your prostate protection playbook: your doctor, your expert guide. Think of your doctor as the chief engineer of your amazing body factory. You wouldn't try to fix a complex car engine without a skilled mechanic, right? Your prostate is even more intricate. This is why regular medical checkups, especially once you hit 40 or 50, are not just a good idea, they are essential. Don't just go in for a quick yearly physical and leave. Be proactive. Tell your doctor about any changes you notice, even small ones, like going to the bathroom more often or a weaker stream. Don't be embarrassed. They've heard it all before, and they're there to help you. Your doctor can do two very important things for your prostate health. The PSA blood test. This is a simple blood test that measures something called prostate-specific antigen. Think of PSA as a tiny little alarm bell. If this alarm bell starts ringing louder than usual, it doesn't automatically mean you have cancer, but it means your prostate might be having some trouble, and it's worth a closer look. It can signal BPH, prostatitis, or yes, even early prostate cancer. It's a fantastic tool for early detection, and that's the key. The digital rectal exam, DRE. Now I know what you're thinking. Oh, that one. And yes, it's not the most comfortable few seconds of your life, but it's incredibly valuable. Your doctor uses a gloved finger to gently feel your prostate. They're checking its size, shape, and if there are any bumps or hard spots that shouldn't be there. Think of it as a quick physical check of the guardian gland. This simple exam, combined with the PSA test, gives your doctor a powerful 1-2 punch for early detection. Remember, if something is found, catching it early makes all the difference in the world. It means more treatment options, less invasive procedures, and a much higher chance of successful management or cure. This is where the power of being proactive truly shines. Don't let fear keep you from these important checkups. Knowledge is power, and early knowledge is life-changing power. So, let's wrap all this amazing information together. Prostate problems are common as we age, yes, but they are not a hopeless sentence after 40. You don't have to despair. You don't have to just live with it. Your energy, your comfort, your quality of life, they are all within your control. By understanding why these problems happen, the growing pillow, the angry guardian, the silent invader, and by actively using your prostate protection playbook, amazing diet, regular exercise, proper hydration, stress management, good sleep, and yes, healthy sexual activity, you can significantly reduce your risk, stop issues early, and even reverse some symptoms. This is your invitation to take control, to step up and be the manager of your own amazing body factory. Don't let the myths or the feeling of just age hold you back from living a vibrant, energetic, and comfortable life well into your 50s, 60s, 70s, and beyond. You have the knowledge now. You have the tools. You have the power to make a difference in your own health story. If you found this video valuable, if it gave you hope and a clear path forward, do us a huge favor. Hit that like button right now. It really helps this message reach more men who desperately need to hear it. Make sure you're subscribed to Dr. Therapy so you don't miss any of our life-changing health truths. And click that notification bell so you're the first to know when we release our next video. And now, I want to hear from you. What's the one change you're going to make today to support your prostate health? Let me know in the comments below. Stay healthy, stay proactive, and I'll see you in the next video.